The term, gluten-free diet, refers to a diet plan that does not include any foods that contain gluten. Wheat, barley, rye, and triticale, which is a hybrid between wheat and rye, are all sources of gluten, which is a type of protein. When it comes to controlling the signs and symptoms of celiac disease and other medical illnesses that are related with gluten, a diet that is free of gluten is absolutely necessary. However, a gluten-free diet is also popular among those who have not been diagnosed with a medical condition that is related to gluten exposure. It is stated that the diet will enhance health, lead to weight loss, and increase energy levels. However, additional research is required to verify these claims. The illness known as celiac disease is characterized by the activation of the immune system brought on by gluten, which causes damage to the lining of the small intestine. For an extended period of time, this injury hinders the body from absorbing nutrients from food. An autoimmune disorder is what is known as celiac disease. Even though there is no damage to the tissues of the small intestine, non-celiac gluten sensitivity can induce some of the signs and symptoms that are associated with celiac disease. These symptoms include abdominal pain, bloating, diarrhea, constipation, foggy brain, rash, or headache. However, the mechanism is not fully understood, despite the fact that studies have shown that the immune system plays a role. Gluten ataxia is an autoimmune condition that affects certain nerve tissues and results in difficulties with the controlled movement of muscles and the voluntary movement of muscles. Wheat allergies, like other types of food allergies, are caused by the immune system mistaking gluten or another protein found in wheat for a pathogen that causes disease, such as a virus or bacteria. Wheat allergies are also known as wheat sensitivity. In response to the protein, the immune system produces an antibody, which in turn triggers a response from the immune system that may result in symptoms such as congestion, difficulty breathing, and other symptoms. Specifics of the diet. In order to adhere to a gluten-free diet, it is necessary to pay close attention to the foods that are consumed, the components that are present in foods, and the nutritional value of those foods. Fresh foods were permitted. Numerous items that are naturally free of gluten can be included in a diet that is healthy. Assorted fruits and veggies. The natural, unprocessed forms of beans, seeds, legumes, and nuts in their respective forms. The eggs. Fish, poultry, and lean meats that have not been processed. Most dairy products that are low in fat. The following types of grains, starches, and flours are acceptable components of a gluten-free diet. The following foods are gluten-free: amaranth, arrowroot, buckwheat, cornmeal, polenta, and cornmeal, all labeled as gluten-free. Flax. Flours that do not contain gluten, including rice, soy, corn, potato, and bean flours. Hominy, also known as maize. Rice, including wild rice, made from millet and quinoa. It is sorghum. Cassava root, also known as soya root. Teff's grains are not permitted. Steer clear of any and all foods and beverages that contain the following. As a result of a cross between wheat and rye, triticale is a hybrid of wheat and barley. In certain instances, oats. The manufacture of oats can result in contamination with wheat, barley, or rye, despite the fact that oats do not contain gluten by their very nature. Oats and items made from oats that are labeled as gluten-free have not been contaminated with gluten. However, there are certain individuals who suffer from celiac disease who are unable to accept the gluten-free labeled oats. Know the words for wheat. Wheat can be found in a number of distinct types, and each of these variations contains wheat gluten. A blend of durum einkorn, emmer kamut, and spelt. In accordance with the manner in which the wheat is milled or the flour is prepared, several names are given to wheat flours. Every single one of the following flours has gluten. Flour that has been enriched with additional vitamins and minerals. Milling wheat that is typically used in hot cereals is called farina. A coarse form of whole wheat flour known as gram flour. Wheat flour that rises on its own, often known as phosphate flour. Pasta and couscous are both made with semolina, which is a component of milled wheat. Food labeling that are gluten-free. When purchasing manufactured foods, it is imperative that you scrutinize the labels in order to ascertain whether or not they contain gluten. Foods that contain wheat, barley, rye, or triticale, or a component that is produced from any of these grains, are required to have the name of the grain included in the list of ingredients that is printed on the label. Among the foods that may have these labels are: food that is naturally devoid of gluten. An item that has been processed and does not contain any ingredients that contain gluten. Gluten-free food is food that has not been cross-contaminated with gluten-containing components during the manufacturing process. A food item that contains gluten but has been treated to remove gluten from the component. It is possible to designate alcoholic beverages as gluten-free if they are manufactured from naturally gluten-free components, such as grapes or juniper berries. A label that states that an alcoholic beverage was processed, treated, or crafted to remove gluten can be attached to a beverage that is made from a grain that contains gluten, such as wheat, barley, rye, or hybrid grains like triticale. On the other hand, the label must say that the gluten content cannot be determined and that there is a possibility that the beverage contains glucose. There is a possibility that certain beverages will not be labeled as gluten-free. Foods that have been processed and tend to include gluten. In addition to foods that contain wheat, barley, and rye as probable components, these grains are also commonly used as components in a variety of other items. Additional ingredients include wheat or wheat gluten, which is used as a thickening or binding agent, flavoring, or coloring agent. It is essential to check the labels of processed foods in order to ascertain whether or not they contain wheat, barley, or rye. The following foods should be avoided in general, unless they are specifically labeled as gluten-free or are manufactured with corn, rice, soy, or another grain that does not contain gluten. Beers, ales, porters, and stouts, which typically contain barley. Loaves of bread. Wheat from bulgur. Desserts such as pies and cakes. Candies. Sweets. Grains of cereal. The wafers of communion. Various crackers and cookies. Croutons. The French fries. Gravies, plural. Copycat meat or imitation seafood. Barley, malt, and other goods made from malt, including malt flavoring. Matzah. The pastas. The lunch meats and hot dogs that are processed. Dressings for salads. Various sauces, including wheat-based soy sauce. Mixed rice with seasonings. Snack foods that have been seasoned, such as tortilla chips and potato chips. The poultry that bastes itself. Mixtures of soups, bouillon, and soups. Veggies submerged in sauce. Medicines and nutritional supplements. There is a possibility that wheat gluten is used as a binding agent in both prescription and over-the-counter drugs. Talk to your chemist or your doctor about the medications that you are now taking. It is required that the word wheat be printed on the label of dietary supplements that include wheat gluten. Consumption of gluten-free foods both at home and at businesses. Individuals who suffer from celiac disease, in particular, should make every effort to avoid coming into contact with gluten. If you want to avoid eating gluten-containing foods when you go out to eat, the following advice can help you avoid cross-contamination in your own meal preparations at home. Store foods that do not contain gluten and foods that do include gluten in separate locations. Cooking surfaces and locations where food is stored should be kept clean. Perform a thorough cleaning of the kitchen equipment and dishes. If you want to avoid cross-contamination, bread should be toasted in the oven, or you might consider using 2 toasters. If you want to make sure that there are options available for you, it is best to read the menus of restaurants online in advance. When a restaurant is less busy and better equipped to meet your requirements, it is best to eat there early or late in the day. The outcomes. People who have celiac disease are required to adhere to a restrictive diet that is free of gluten for the rest of their lives. It is possible to reduce the severity of symptoms and consequences associated with the condition by adhering to the diet and preventing cross-contamination. Gluten sensitivity that is not caused by celiac disease may not be a condition that lasts a lifetime for some individuals. After following the diet for a particular amount of time, such as 1 or 2 years, it is recommended that you reevaluate your sensitivity to gluten. This is according to the findings of some research. People who do not have celiac disease but are sensitive to gluten may require the diet as a treatment for the rest of their lives. There have been a few clinical studies that have investigated the benefits of the diet for individuals who do not have celiac disease or who have gluten sensitivity that is not caused by celiac disease. There is a need for additional research to evaluate whether or not the following statements on the results of the diet are accurate. Loss of weight. Enhancement of health in general. Health improvements in the digestive tract. Enhanced performance in athletic endeavors. Dangers. A gluten-free diet excludes certain foods that are rich in vitamins and other nutrients, but these items are still essential. For instance, Breads made with whole grains and other items containing whole grains are natural or fortified sources of the following: iron, 35% calcium fiber, the riboflavin, niacin and folate. As a result, adhering to a gluten-free diet will most certainly result in a shift in the nutrients that you consume. In comparison to the items that they are intended to replace, certain gluten-free breads and cereals contain dramatically different amounts of various nutrients. There are certain gluten-free foods that have higher levels of fat and sugar compared to the gluten-containing food that they are intended to replace. Read labels carefully, not only to determine whether or not a product contains gluten, but also to determine the overall nutrient levels, salt content, calories from fats, and calories from sweets. Talking to your physician or dietitian about foods that might provide alternatives that are nutritious and high in nutrients is something you can do. Amounts. In most cases, the purchase price of gluten-free foods that have been prepared is higher than the price of the goods that are being substituted. There is a possibility that adhering to a gluten-free diet will incur significant costs, particularly if the diet in question includes goods that are not naturally free of gluten. Like, share, subscribe, comment.